Well, again, just really appreciate you guys coming here. And, there's been so much media attention about this. And we've been working kind of nonstop on this, I think, really since really the end of December, really when it first became an issue. But one of the things that we've kind of noticed is that really everybody's talking about stuff as it comes out, but nobody's really talking about the significance and why do you need to be concerned about this. So we wanted to make sure that we were all on the same page on why this is something that we as a community, as a country, as a global community need to really pay attention to this. So that's really what this is about today. And it's just kind of the nuts and bolts. Then we want to talk a little bit about what are some of the public health measures that we need to implement, and then kind of some new rules for navigating a global universe in terms of minimizing your risk for infection. And stop us anywhere along the way with questions. But again, very basically, just a kind of overview that this is a coronavirus, which is actually, you hear that all the time because hospitals test for that routinely when you present with a cough and fever. But that's the family of viruses, and typically what it causes is just the common cold. But this is a novel virus, and because it's novel, there are some things about it that make it unique, that make it really important, that initially we try and contain this until we find out more. And just really want to talk a little bit about why that's so important. We've had people say, well, you should pay more attention to flu, don't be worried about this. And I don't want you to worry about any of these things. I want you to be, paying attention to and minimizing your risk through vaccines and whatever other measures. But I do think there are reasons why we need to be concerned about this. But we want to strike the right balance. And I think I've said that to you, Rosa, before. I feel really blessed that in the 20 years I've been here, the media have always struck the right tone, and that is of concern, but not running around like your hair is on fire. And so we're counting on you to be able to get this message out in a way that really, we want people to be concerned, but we don't want them to be afraid to go eat at a Chinese restaurant. On the other hand, I don't want them to plan to go to see the Great Wall of China on their spring break, right? We want to strike the right tone. So that's what this is about. So again, because it's a novel virus, what that means is until really late November 2019, it only could infect animals and cause disease in animals. Somehow, and they call those wet markets where you have produce and you have live and dead animals and all of that coming together with humans, that created an environment where it facilitated a mutation that now allows it to infect humans, and not only infect humans, but cause disease. And so that's what we're talking about now, the COVID. They finally come up with the professional, or the official name, I should say, and that's COVID-19. But there's so much that we don't know about that really influences how concerned we need to be about it. But the first thing that you have to think about when you have a novel virus is that nobody except those 43,000 people who have been infected have any immunity. So you're talking about a global population of almost 8 billion, and only 43,000 people have immunity. And you and I rely every day on herd immunity to prevent us from getting sick from just tons of things. And it's either because we've had it before, or somebody else in the community's had it before, or we've been vaccinated against it. But herd immunity is what stops widespread transmission. And so when you have a novel virus, and essentially 13 people in the United States have immunity to it, you could have the potential for a lot of widespread transmission. So that's why the herd immunity is really a big deal. And part of that is because we don't know how severe the disease is going to be. This is novel. Is it going to behave like 99.9% of coronaviruses and cause an irritating, miserable cold? Or is it going to behave more like SARS or MERS, which were also novel coronaviruses that actually caused life-threatening disease in about 20% of the cases and had mortality rates a lot higher than what you would obviously expect with a cold? We don't know that now. But part of the other problem with that is then we have no treatment. So I don't know how severe this disease is going to be. It could spread easily in the community, but number one, I can't diagnose it because I don't have a readily available local lab test. So I don't know when you come in with fever and cough, is it RSV, is it influenza, is it coronavirus, is it pertussis? I don't have a test that can help me understand what you have readily available. But in addition, I don't have any treatment. So if you come in with influenza and you come in a timely manner and you're severely ill, we can start Tamiflu, we can do other things. We don't have that now. So again, we have the potential for having a serious illness for which we have no treatment. So that makes it difficult. In addition, we don't know how easily it spreads from person to person. Is this something that some diseases, every person infected infects 10 other people? Some diseases, every person infected usually will infect 2 other people. We don't know that now. So again, it's all that we don't know about that. And finally, one of the most important things is we have no vaccine. And vaccines, they're not 100% effective. Most vaccines are usually around 90% effective plus. When you look at measles and pertussis and all those things. Influenza varies because there's so much more mutation in those viruses. But the other thing that we know about vaccines, that if you've been vaccinated and you're exposed and you get the disease, it can prevent you from dying. So it not only prevents you from maybe getting the disease in the first place, but it can really be effective in terms of minimizing your clinical course if you do get the disease. But we don't have that here. So for all of those reasons, until we know the answers to those questions, how easily it's going to spread, is it going to cause a severe illness, or is it going to be, as I call it, a nothing burger, or is it going to be something that we need to pay attention to, until we develop the capacity to be able to diagnose who has that and provide a treatment, we need to do what we do best in public health, and that is contain. That's one of our best public health measures, and Erika is going to talk a little bit about what does that mean and why do we do it.
Sure. So as Dr. McMahan said, when you don't have treatment, you don't have a vaccine, and you don't have any herd immunity, really the only thing that you can do to try to limit the spread or contain a virus is to separate yourself from that virus. And that's typically done through isolation and quarantine. So the president did pass a proclamation that suspended entry to foreign nationals into the country, and also the CDC has started rerouting all flights to 11 different airports where they're screening all passengers that are allowed to come back into the country for symptoms upon arrival. And so currently, people are kind of falling into two different options, either isolation or quarantine. And just in a general sense, isolation typically is somebody that has been exposed but is also believed to be infected with the virus at the time. They could be showing symptoms. So that is typically taken a little bit more seriously than a quarantine, where that's somebody that's been exposed but isn't showing any symptoms and is not believed to be currently infected with that virus. They're both meant to stay around people of the same exposure level so that they don't expose anybody else. So right now, if you arrive in the United States, you are rerouted to one of those 11 airports. You're screened for symptoms. And the CDC has categorized different risk categories. So you are considered high risk if you come specifically from the Hubei province in China, or if you have cared directly for somebody that has laboratory confirmed novel coronavirus and you did not use the appropriate precautions at the time. Those people, regardless of what their symptoms show at the airport, are immediately placed into isolation when they get here, or quarantine. And then medium risk people would be somebody coming from mainland China, not specifically the Hubei province, but anywhere in mainland China. And they are screened for symptoms. And at that time, if they are currently symptomatic when they're screened, they go into a federally mandated quarantine. Isolation and quarantining is occurring at the site of the airport or close by. So those people, if they're Allen County residents, would not make it home to Allen County until they were outside of that 14-day window. The only people that are able to finish their itinerary and return home would be medium risk people, so people traveling from mainland China who are screened at the airport and they are asymptomatic. So currently the plan for those people is they are given a packet of information. They return home. The State Department of Health and the local health department are notified, and we enact something called self-monitoring with public health oversight, basically. So we will be checking in with them every single day. They'll be doing twice daily temperature checks, symptom checks for the remainder of their 14-day quarantine period. That quarantine period starts the day that they leave China, so that would be day 0. You would count out 14 days from that. So during that quarantine, it's not a federal mandate for them, so they are asked to stay home to the best of their ability, but there is no legal precedence that says that they have to stay home as the high-risk people coming in do. Was that?
Yeah. So do you understand the differences between the isolation and quarantine? Because sometimes, and who it's applying to now, and the self-monitoring.
Yeah.
And if you're interested in what legal authority do we have to do that, Mindy can address that in terms of what the legal authority that allows us to be able to restrict the movements of people. We've done that before with this isn't just happening with COVID-19. We have had experience with this before, and she's very familiar with the laws if you ever want to talk to her.
Can I just check a couple things with you? All right. So, if you are a high-risk person, that would be someone who is coming from Ubai, I can't say that,
Uh-huh.
province, or cared for somebody with the virus.
Uh-huh.
Okay. Medium risk would be somebody coming from mainland China.
Mhm.
Okay. And they would be tested to see if they have symptoms, and if they're healthy, they can go home. Is that right?
No, so, well,
Well,
for
not
medium
tested.
risk.
Yeah.
Yes, I just
Yeah.
wanted to clarify
Yeah.
I
that.
said
Questions,
that.
yeah.
Yes, question.
Yeah, so basically if you're
And they
high.
take your temperature.
They screen 'em. Yep.
Yeah,
Mhm.
if you're high
Mhm.
risk, you only have two options. You either go into a mandated isolation or a mandated quarantine.
Okay.
Both of those will be in the city of whatever airport you're arriving in, whatever arrangement they have made for where they're housing those. Medium risk, they're screened, and if they are symptomatic, they go in to the same isolation that somebody that's high risk would go into. The only difference is if a medium risk person doesn't have symptoms, they are able to come home. And those would be the people that we would expect to see here, that we would monitor then for the 14 days. And they are not federally mandated into quarantine, but they are strongly encouraged to stay home for 14 days if they
All
can.
right. So at that point, does the federal government or I don't know which health officials would do it, actually notify the local health?
Yes,
officials?
so there's a system in place.
Okay.
It's the Global Division of Migration and Quarantine will notify the Indiana State Department of Health, who then notifies us.
Okay.
And we have 24 hours to get all of that done and make first contact with the travelers.
You have 24 hours on the way.
And Megan can provide you some information, because we have some written materials
Mhm.
that kind of because the risk, and if so, she can send that stuff
Yeah,
to
we've
you.
got some good stuff, some copies
Okay.
here.
Oh, I see.
Kinda
She's already got it.
outlines
Yeah.
that traveling protocol and
Mhm.
then just some of the frequently asked questions that we're getting as well.
I was just kind of wondering, Indiana's not the greatest place to have health departments, local health departments everywhere.
Mhm.
Does the state then take over in I don't know, Jay County or someplace? I'm just.
They can,
Yes.
They have field epidemiologists that can do this kind of stuff.
And I believe they have a plan for, the larger counties are pretty well equipped to do that with
Mhm.
just consultation with the state. The smaller health departments, they have a plan to assist them.
Okay.
And an important clarification to make, that isolation and quarantine period is 14 days no matter what. So even if somebody has symptoms and they're tested and they test negative, they still stay in isolation or quarantine because the testing hasn't been studied enough to know that they can't still become infected. So they don't know exactly with the testing that they do at what day after exposure your virus load is high enough to actually be detectable. So it's 14 days across the board regardless of testing.
And we have done this monitoring before. We did it with Ebola and stuff, so we've actually done this kind of stuff before.
Did you do it with MERS and SARS also? Or no?
We didn't have any
We
cases.
didn't have any cases,
Okay.
but
Did you have any cases of Ebola? No.
we didn't
No,
have
but
any
we had
cases, but
travelers
we had
return.
travelers.
Travelers.
It was a
Okay.
similar circumstance then, and so similar in being notified and then following up with those folks daily or as needed.
And people were very cooperative, weren't they, by and large?
Mhm.
Mhm.
Yeah.
Yes.
Okay, you can do whatever you want now.
Do you want to talk about
Yeah.
testing or?
Testing, or just kind of the summary of where we are, what we know
Yeah.
so far today?
Well, I can just give you the update. I'm sure you guys have seen the numbers, but so far as of this morning, I always put the caveat of what day and what time. At 9 o'clock this morning was the last I checked. We're at 43,103 cases in the world, 1,018 deaths. Of those cases, 42,708 have been in China. 1,017 of the deaths have been in China. So all but one of the deaths have occurred in China at this point. And then there have been 395 cases outside of China in 24 different countries. We have 13 cases here in the United States, 0 deaths in the United States, and there are currently 68 people under investigation waiting for lab results from the CDC right now.
Say the last one again.
68 people under investigation. It's called a person under investigation, so you have to meet certain criteria. Basically, you have to have symptoms plus travel to the appropriate area within 14 days. If you meet those criteria, the CDC will give clearance. They're the only laboratory right now that's testing. Pretty soon you'll start seeing state laboratories testing, but as of today, all specimens are being shipped to the CDC laboratory for testing. But as Dr. McMahan said, so much of this is still under review and being researched, but what we believe to know right now, the symptoms that we are watching for would be fever, and that is subjective patient to patient, so not every patient has had fever. Cough and shortness of breath, those would be the symptoms that we're monitoring our travelers for as well. The incubation period has been documented as early as 2 days after exposure, all the way up to 14 days after exposure, which is why you see the 14-day quarantine and the 14-day isolation periods being put into place. And you already commented on how it spread. Originally thought, or we know it originated from animals, then crossed over to humans, and is now spread human to human, and thought to be spread very similarly to other respiratory diseases through respiratory droplets, which is why we try to reassure. We've been getting a lot of questions about getting packages from China, so just ensuring people the amount of time that it takes a package to arrive here from China without any temperature control is typically enough time and high enough temperatures that the virus would no longer be active by the time it got here.
I just read today that they're thinking that it's 4 days it can live on a surface.
Well, that's okay.
Yeah.
That was one of my questions.
But again, that's all prelim. Talking about the severity of the disease, the range is anywhere from 2%, but there was a study done on the first 100 people to where the mortality rate could be 11%, which was more consistent with what we saw with SARS, which it's most genetically similar to. So that's not kind of a surprise. But the severity of illness really is a function of whether it becomes an upper respiratory disease or if it's mostly a lower respiratory disease, and with an accompanying very robust immune response. And that's what happens called ARDS, acute respiratory distress syndrome. And that's what happens when we see that with SARS, with MERS, with H5N1. When people have, or even just garden variety influenza, what usually is the cause of death is the development of this robust immune response that just actually then begins to start to destroy the lungs. And then that sets them up then to get a secondary bacterial infection. So right now, in the first, I think, 100 cases, about 17% of the folks developed ARDS. So again, that's going to change as we go along. But again, is this going to be just a common cold, or is this going to be something that is a lower pneumonia with an accompanying ARDS syndrome? So that's what we're looking for.
Mm-hmm.
So just kind of thinking, was there anything more that you want to say? I think what's interesting, I might have said that before when we first started, what was interesting to me, because we're looking at this stuff all the time, to see that on January 24th there were 800 cases, and today there's 43,000. I think that jump in cases is enough that we need to continue with the watchful waiting and not just think, well, it's probably just going to be nothing. I think that jump is enough that we need to still continue to be vigilant and pay attention. So that's one of the reasons, again, we want to. The other thing is, again, this will be a marathon. If this would in fact become a pandemic where it would become something that actually would come to the United States, Mindy and I were talking before. You guys are too young, but Rose, I don't know if you remember with H1N1, we had our clinic, Mindy was reminding me, 8 months where we were providing vaccine.
4 months for straight up vaccine from the beginning of it, every single day at an off-site location with over half of our staff. So that, if it was to be something like this, she's right, it's a bit of a marathon in that it could go on for a long time, and it could be a shift in how we provide those services. But that's another reason for talking today, is so that you know that we are preparing for that we have experience with it, and so that we would be ready and are monitoring the situation daily.
One of the things, just kind of looking at this situation, just kind of looking kind of over the past 20 years, is just you've just really seen with global travel the evolution of these novel viruses at a rate kind of unprecedented, really, when you think about it. Before, we would talk about pandemics occurring every 50 years, every 100 years, and now it's like, more often that we're seeing things, because remember we had SARS in 2003. West Nile virus came here. It wasn't a novel virus, but it had never been in the United States. Remember that for like 2-3 years until we developed enough immunity. We had a lot of people getting sick because it was new to the area. Then we had H1N1, then we had MERS. So even even if this would, and we're all hoping that this just kind of burns out, I think it's time to kind of look at our relationship with the living environment that we live in every day, maybe a little bit differently. And so we've got some new things that we're kind of thinking that, in addition to just washing your hands, if you go on the CDC website, you need to wash your produce, because you may not have been in South America, but your lettuce may have. So in the 2020 world, not just washing your hands, but washing your produce, realizing again you live in a living environment. The other thing is there is plenty of evidence and science that you should get every vaccine that's recommended based on your age and underlying conditions. There is nothing more studied post-marketing than vaccines. And this day and age, you need to take advantage of that, because statistics help us kind of allocate resources, allocate risk. But I can tell you, if you get it, it's 100%. Right? Doesn't matter if there was only a 5% chance of getting it. If you have it, it's 100%. So get every vaccine that you can get. The other thing is, we always say stay at home. But I think if you're sick, but really think about taking a fever seriously. As an adult, adults usually don't get fevers unless there's something going on. It means either the viral or the bacterial burden is high, your immune system's in warfare against this, especially if you have a cough or you have diarrhea. If you have a fever, number one, stay home. And the other thing is, you should touch base with your doctor. They'll tell you if maybe you need to do something differently, maybe because you're diabetic, you need to check your sugars more frequently. Touch base with your doctor if you have a temperature more than 100.4. And definitely don't go to work, especially if you're in food service or healthcare, or you take care of children. There are actually laws, and Mindy can tell you about that, about when you can go back to work if you have those symptoms. So take a fever seriously. And the last thing is, if you're traveling outside the country, you need to visit the CDC travel website. Yes, we have the COVID-19, but there are polio outbreaks right now. There are measles outbreaks. There's Ebola. There's dengue. You can't assume that the country you're going to, even if it's to do a missions trip or to do business, they don't have the public health infrastructure that we have. So you need to go and see what is available and what you should be on guard for. We want you to come home with souvenirs, memories, not malaria. And we've actually had that happen here, okay? To that end, the county and the Department of Health has really made low cost the ability to get those travel vaccines, to get anti-malarials. It's our cost. We don't make any money doing it. And in today's world, that needs to be part of your travel itinerary. You should know what you need to do to protect yourself before you even go. And we're happy to accommodate that. And like I said, if you ever want to do a mock visit, what that would look like, I'm sure Susie would be happy to accommodate you with that. But that's something that I think this traveling, you really need to think about it. I don't want you to be a fearful traveler. I want you to be an informed traveler. And to do that, you need to look at the website. So those are the things, kind of thinking about how do you navigate, new decade, new diseases, a few simple rules to lower your risk of acquiring a disease anywhere in the world. It's kind of like the way we're taking, because everything's so global anymore. You just need to be thinking globally when you're thinking about how to minimize your risk of acquiring any infections. So I think that's really all we have in terms of what we wanted to make sure that we're all on the same page, but we're happy to answer any questions.